Talia Marcheggiani, and I am a naturopathic doctor. I work at Bloor West Wellness Clinic in Bloor West Village in Toronto. Naturopathic medicine is a primary healthcare modality. A naturopathic doctor acts like a general practitioner of natural medicine. Naturopathic doctors have 8 years of post-secondary education. Naturopathic medical school is 4 years full-time education. It's very similar to conventional medical school. Students are trained in the life sciences such as anatomy, physiology, diagnostics, and microbiology, molecular biology, in addition to the naturopathic therapies. Natural therapies that we're trained in include acupuncture, botanical medicine, homeopathy, nutrition, lifestyle counseling, physical manipulation, and Western herbalism. During initial intake, I sit down and talk about your entire health history. So we'll go through all of the signs and symptoms that you're experiencing, as well as different indicators of how your body is and whether your body is in a state of balance. This includes talking about sleep, digestion, energy, if you're a woman, menstrual health, your sexual history, even your relationships and work. My studies through life sciences and finally naturopathic medicine were part of this journey to understand how scientific research and what we know about science and the body combines with traditional healing systems and ancient systems of medicine. Some of the healing systems that naturopathic medicine draws on are thousands of years old. In the case of Ayurvedic medicine and traditional Chinese medicine, the fact that these systems are still around, I think, lends to the idea of how powerful they are. When I was studying my pre-medicine degree at Queen's University, I felt dissatisfied with a lot of the education I was getting. I found that even though we were learning all of this information about how far science had come and we knew all these intricate molecular mechanisms of the body, I still wasn't getting the answers that I was looking for. I wasn't feeling well. I was feeling extremely stressed out. I went through a whole year without having a menstrual cycle. I was frequently getting sick and I felt exhausted and I felt depressed. And when I sought medical treatment through a conventional doctor, I was told this was normal and that there was nothing wrong with me, but I continued to feel sick. When I finally decided to seek treatment from a naturopathic doctor, I experienced something completely different. My naturopathic doctor sat down with me, got to know me as a person, and asked me a bunch of questions that I hadn't even considered could be related to my primary concern. I was given a chance to tell my story, I wasn't interrupted, and I felt like I was working with this professional who had all this education behind them to work collaboratively and find out what was going on with me beyond the surface of my symptoms. I was being listened to as a person, and we were going to work together to find out what was going on in my body. This aligned with the intuition I had about what was going on with me. I felt like there was something deeper going on. Like many of the people that work in this system of medicine, we found this healing in ourselves, so we believe in the power of natural medicine. I frequently experience how powerful even changes in diet can be for how it affects my mood and feelings of well-being. Unfortunately, naturopathic medicine is not covered by the Ontario healthcare system and must be paid for out of pocket privately by patients. Fortunately though, most people that have full-time work have coverage for naturopathic medicine under their benefits package. Usually my patients spend around $500 to $1,000 a year with me. This might seem expensive when we look at how our healthcare system is free. However, when you break down to what you spend a month compared to what you'll spend on things like going out to dinner or seeing a movie or buying cosmetics to cover up underlying health problems, this is actually kind of cheap. If you think about it, it's less than $50 a month to have the best health you've ever felt in your life. I think that in our society we need to start investing more in our health, especially in the area of preventative medicine. I think one of the problems in this system is that medicine is very reactive in nature in the way that it's practiced. You go to an emergency room and you see your doctor when you're already in a state of disease. You're already experiencing symptoms. I find the best time for patients to come and see me is when they're just feeling slightly unwell, when they're feeling off balance, or maybe they've just received a new diagnosis. This is the time when we can start to make drastic changes, when we can move the needle drastically and restore people back to a state of health. If you think about it, the longer that you suffer from something, the longer it will take to heal, since naturopathic medicine aims to remove the body's obstacles to cure and strengthen the body's own healing mechanisms. I think it's important to look at the cause behind these symptoms. Because if you think about it, there's no way for our body to communicate how it's doing and how it's feeling. So symptoms are messages from our body that things are out of balance and that we need to pay attention.